Welcome to eGurukul, part of DBMCI. In this session, I'll be going over a few questions that were there in this NEET PG 2021 exams, most awaited exams, and I'm very glad to say that the examiners have made this easy, comparatively easy, because they knew that students are not going to college, they are not getting proper, like 100% guidance as 101 with the teacher interaction. But I'm very happy that my students are glad they have done the 100% in their biochemistry exam, because most of the questions that were there in the exam were, we had discussed them in the class, we had discussed them in the GTs, also in from the notes there were exams. So my students, they attempted, I guess most of them attempted 100%. I am recording this video just to give you insights how we usually should think about the question when we are reading a question. I don't have exactly the answers for all the questions. Maybe my choices I'm giving you in this video might be wrong, but I just want to focus on the thought process. What could be right, what could be wrong. If this was given, this could have been the choice. But let's say one scenario changes in the case study, then the entire result will change. तो थोड़ा थोड़ा ऐसा करके करेंगे. So I hope by this time your nerves are calmed down. You are calmed down. Don't worry. I know you have gave the 100%. ठीक है, जब हम अपना 100% दे देते हैं, that's all we can do. The second is the luck. Otherwise, always keep trying, keep trying, keep trying. One day you will succeed. Okay, कोशिश करने वालों की कभी भी हार नहीं होती. So don't think too much. Exam हो गया है, result आ जाएगा, and then you will know what is going on. Remember, your parents, they still love you. They will always love you, and they had loved you in the past. No matter क्या होता है एग्जाम में, वो हमेशा आपको बहुत प्यार करते हैं. हम भी आपको बहुत प्यार करते हैं. We will always there to support you. Okay. So there was this question. This student told me that, ma'am, there were 4-5 pictures with the globoid cells का था, ma'am, crumpled tissue appearance था, and the patient was presented with this, like the 5-year-old male was presented with this anemia, bone pain, hepatosplenomegaly. These were the vague things he could remember. So I have picked out many pictures for the globoid cells. कितना कितना तरह से हो सकता है. Maybe one of this picture was there out of 4 pictures that were given to you, and definitely this was very easy. Person who are attending the grand tests also, I have told you very many times, this is directly the glucocerebrocyte disease. Okay, now remember here एक थोड़ा ट्रिकी था कि I don't know what was the option, but alpha galactosidase लिखा है. तो those who got confused, I know my students never will get confused. They know this is alpha glucosidase in case of the Gaucher disease or the glucocerebrosidase. So glucocerebrosidase, alpha glucosidase, not the alpha galactosidase. Okay, so this was very direct and simple questions, and how this entire glucocerebrosidase thing happens, how hepatosplenomegaly happens. We know that all the waste materials, right? Whenever we are eating something, digesting something, there are the waste materials. Macrophages, they swallows the waste material, right? And they form the lysosomes. Okay? During the normal activity, the waste material is degraded by the enzyme. Okay, but in the Gaucher disease, because of the deficiency of one enzyme, that is glucocerebrosidase, in Gaucher disease case, that lack of enzyme leads to the deposition of the waste materials in the lysosomes. Okay, this is what is happening, and that's how this crumpled tissue appearance is seen in the slides also. Okay, what we are digesting with this glucocerebrosidase enzyme is glycosphingolipids को हम digest कर रहे हैं, right? कौन सा glycosphingolipid in my this slide is glucosylceramide. Remember, इसमें हर चीज ग्लूकोज से शुरू हो रही है, गैलेक्टो कुछ नहीं है. तो इस तरह से भी तुम नाम याद रख सकते हो, ग्लूकोसिल सेरामाइड, ग्लूकोसेरेब्रोसाइडेज, Gaucher disease, right? And that will give you glucosyl ceramide. When we digest, it gives you the glucose and the ceramide. If the deficiency of this enzyme, like in the when the enzyme is not present, it will lead to the Gaucher disease. These are another two pictures of the globoid cells that are crumpled tissue appearance that we see in the slides. Okay, and this is the table I have shared you many times in the GTs also, that the Gaucher disease is because of glucocerebroside or beta glucosidase, right? And major accumulating sphingolipid. This is a part of the sphingolipidosis. Okay, glucocerebroside, and primary organ involved is liver, spleen, bone. Okay, so hepatosplenomegaly question में था, severe bone pain क्वेश्चन में था, राइट? सो एंड इन्फेंटाइल फॉर्म इन्फेंट्स में ज्यादा होता है, तो मोस्टली यही पूछा जाता था in the past. I'm glad this same was repeated in this exam also. Very direct, very easy question. If let's say it could have been the Fabry's disease, then we will see the galactosidase and only the kidneys were involved in that case. If beta galactosidase, that is the crab, that will show the primary organ involvement is the brain. कुछ ना कुछ ब्रेन से रिलेटेड दिखाते कि the thinking process is not normal और कुछ तो ऐसा दिखाते. How we remember is this Fabry crab right, is involved with the galacto, right, galactosidase, alpha galactosidase, beta galactosidase is Fabry crab. Okay, hexoaminidase is A, is Tay-Sachs, ATTA is Tay-Sachs. Okay, A and this T is hexosaminidase. Okay, यही ज़्यादातर पूछे जाते थे, but I'm glad Gaucher was asked. And from the notes also, if you have those who have studied very carefully the notes, it was given in the notes also. Here, this is the Gaucher cells are seen in the Gaucher disease. This was on page number 101, 102. Okay. उसके बाद Gaucher cell has wrinkled crumpled tissue paper appearance. बहुत ज़्यादा, it's like the points we are pinpointing. Okay, the last minute revision point kind of a thing was there. You could have seen ऐसा diagram, कुछ ना कुछ दिया जाता था, and right, and then there was this table also. बहुत बार memorize किया है हमने इस table को, that in the Gaucher disease the enzyme deficiency is glucosidase enzyme, right? And also Gaucher disease or explain किया, most common is sphingolipidosis, most common liposomal disease storage disorder because of beta glucosidase enzyme, sometimes also written as glucocerebrosidase, glucosyl ceramidase भी कई बार ऑप्शन में दिया हुआ होता है, बट तीनों का मीनिंग ऑलमोस्ट लाइक सेम ही है. हम इधर वी कैन से इट इज बीटा ग्लूकोसाइडेज एंजाइम, glucocerebrosidase enzyme, glucosyl ceramidase enzyme, right? And in this cherry red spot was not seen. ऐसा भी कभी कभी दिया था. मेंटल रिटार्डेशन इज नॉट सीन, मेंटल रिटार्डेशन कभी भी यूज नहीं करेंगे. स्फीयर एब्डोमिनल पेन भी लिखा हुआ हो सकता है, बोन क्राइसिस भी लिखा हुआ हो सकता है. गाउशर सेल इज सीन, समटाइम्स प्रोफाइल दिया हुआ होता है. ओके, व्हेनेवर देयर इज अ प्रोफाइल गिवन in the special in the Gaucher case, you will see increased serum level of chitotriosidase, TRAP, ACE, PARP, right? All these levels are being increased. Enzyme replacement therapy is given and the test is confirmed by the genetic analysis. Okay, so this was about the Gaucher disease. Very direct, very obvious question was there. We have discussed in the class also, GT also, or notes में भी था. Now there was one question, students were telling me, ma'am, glucose transporter पूछा था, maybe in the GIT पूछा था, whatever was there, and the GLUT1, GLUT2, SGLT1, SGLT2, all these options were given. Well, I did not come to know exactly from where they were asking the glucose transporter, but I have pulled out this image, right, for you, and we have discussed this many times in the class also, that GLUT2, GLUT2 is involved in liver, pancreas, and the brain, right? GLUT1 and GLUT3, they maintain the central glucose homeostasis mainly in the brain. GLUT1 and GLUT3, they in the brain for the central. SGLT, right? That is ATP dependent hexose transport absorption, sorry, in the intestine and the kidney. SGLT is there in the intestine and the kidneys. GLUT4, GLUT4 is इंसुलिन स्टिमुलेटेड ग्लूकोज को डिस्पोजल को करता है, कहाँ करता है? स्केलेटल एंड द एडिपोज टिश्यू. आई एम एग्जैक्टली नॉट श्योर इफ इट वाज जीआईटी. यू नो व्हाट वाज द ऑप्शन? ब्रेन था, तो GLUT1 GLUT3 में से एक ऑप्शन था. सिंस इसमें मैंने दिस इज GLUT4 एंड GLUT2 ऑप्शंस उसको याद थे, GLUT4 एंड GLUT2. सो माय बेस्ट बेट इज देयर वाज समथिंग रिलेटेड टू द एडिपोज टिश्यूज और द स्केलेटल मसल. So that अगर वो था तो GLUT4 was the choice, right? If intestine और kidney में कुछ mention था तो SGLTs were the choices. Now, in this question, students were telling me that there was a student who was conducting an experiment on the electron transport chain. Here, this is electron transport chain. Initially, he added the pyruvate. And fumarate add किया. So there was ATP production, right? But later on fumarate को cut करके they added one inhibitor that stopped the ATP production. ATP production came to halt. So the question was asking me which inhibitor, and they hinted me, ma'am, probably the term oxidative phosphorylation was halted. Okay, so which inhibitor? Oligomycin, 2,4-DNP, actinomycin, rotenone, all these inhibitors are involved in the electron transport chain. We know that. But this oxidative phosphorylation was the keyword, okay, which was taking us directly to the answer. Answer was oligomycin. कैसे था? In the class notes also, page number 65, 66, there was electron transport chain. Okay, that happens, and we know that it is present in the intermitochondrial membrane, and there are 5 complexes that are associated with it. INI set exam में usually they used to ask about the name of the complex, right? Complex 1 is oxidoreductase, complex 2 is succinate Q reductase, complex 3 is Q cytochrome C oxidoreductase, complex 4 is cytochrome C oxidase. Okay, last is ATP synthase that is involved with the movement of the electrons. Another question usually used to like exam में पूछा जाता था about the chemiosmotic theory, because when the electrons transport from complex 1 to complex 2 to complex 3 to complex 4 to complex 5, there is a net release of proton in the intermitochondrial membrane, and when those protons they come back via the complex 5, via the channel from the complex 5, that is called ATP synthase wala complex, that resulted into the formation of the ATP. Okay, so NADH also usually ये question पूछा जाता था in the past. NADH push out 10 electrons with the NADH, that is why 2.5 ATPs are generated. With FAD enters from the complex 2, complex 1 bypass हो जाता, so only 6 protons are pushed out, that is why FAD is equivalent to 1.5 ATP. Okay, but this time they were asking is which inhibitor inhibited the oxidative phosphorylation, right? So oxidative phosphorylation. So here inhibitor of electron transport chain was given in the notes, also discussed also that complex 1 is inhibited by the rotenone. Okay, complex 2 is inhibited by malinoate, carboxyl extra. Complex 3 was inhibited by antimycin A, one of the choice, right? And cyanide inhibits the complex 4. Oligomycin inhibits the ATP synthase complex. Why I am choosing this as a choice? Because if we look here, इधर क्या लिखा हुआ था? Let me zoom in for you. Complex 5 of electron transport chain, also known as 0F1 ATP synthase, right? It leads to the generation of the ATP. It is a final catalytic segment. In this, oxidation occurs followed by the phosphorylation. If oxidation and phosphorylation was there in the exam, so that means that inhibitor was inhibiting the complex 5 of the electron transport chain. And complex 5 inhibitor given in the choice was the oligomycin. So oligomycin would have been the choice. Okay. If uncoupler का बात था तो 2,4-D nitrophenol is a non-specific uncoupler. तो उसमें हम नहीं बता सकते क्योंकि it inhibits at the various points. It inhibits complex 2 also. It inhibits complex 5 also. So for me, oxidation and phosphorylation was halted. No ATP production was there. So definitely it was an oligomycin that is inhibiting complex 5. Now, this was another question. This is wrong. A patient complains of knee pain, right? Urine turns black on standing. Which enzyme is involved? Simple. Again, बहुत बार पूछा गया है that homogentisate oxidase is involved in here. What is happening? These are the signs and symptoms of the Alkaptonuria. Urine turning black and the knee pain. Okay. So black colored urine because the homogentisate is kept on accumulating, and when it is exposed to the air, then it turns the homogentisate into the black color. Color derived reaction hoti hai wo, right? Sometimes in the question, orchinosis had been seen, the tendinitis is there, kidneys and prostate and calcitis or hunchback, kuch bhi diya hota, but most of the times I have seen is the urine turning black, homogentisate oxidase enzyme is involved. In this I have shown you in various GTs also that here phenylalanine converts into tyrosine. Tyrosine gets converted into 4-hydroxyphenyl pyruvate. हम degradation देख रहे हैं phenylalanine का, right? And then 4-hydroxyphenyl pyruvate gets converted into homogentisate, which converts into 4-malonyl acetoacetate, then 4-fumaryl acetoacetate, which finally gets degraded into acetoacetate, fumarate, succinyl acetone. Acetoacetate further gives you acetyl coenzyme A, and actually it helps. It leads to the ketone body formation. Ketone body formation. Okay, and there are so many enzymes that are involved. Our enzyme is this homogentisate oxidase that is leading to the Alkaptonuria. If this is not working, homogentisate level will increase and it will spill over in the urine. And when that urine is exposed to the sunlight, there is a photochemical reaction turning urine into black in color. It is a rare inherited genetic disease caused by HGD, homogentisate gene, right, which is synthesizing the enzyme homogentisate 1,2-dioxygenase. Okay, the other that were discussed in the GTs were the tyrosine transaminase deficiency, which leads to type 2 tyrosinemia, right? And it is an AR, autosomal recessive inheritance, in which elevated tyrosine and the mental retardation were seen in the patient, but in our choice it was not there. If there is problem with 4-fumaryl acetoacetate, usually hepatorenal toxicity must have been mentioned in the question. Okay, now xanthine oxidase, right, is for the catabolism of purine, right? In this enzyme which catalyze the oxidation of xanthine, uske andar you will see question में severe liver damage, influenza A infection बढ़ जाता है, but these were not given, so xanthine oxidase were not the choice. So for us, the urine turning black upon exposure to air is definitely homogentisate. Very obvious question, Alkaptonuria. And also there were this sometimes kidney stones are also indicated, or maybe bone pains, severe known bone pains, tendinitis being mentioned in the question. Now there was this question, vitamin D, which vitamin deficiency caused this scenario? So Kezel's necklace, very obvious. We know that is a niacin, right? Niacin is vitamin B3. And I have told you many times how to remember this 3. Niacin is stands for B3 is niacin has a C, which is a third alphabet, A, B, C, right? A, B, C, niacin, and 3, B3. So vitamin B3 is 1, 2, 3. B3 is niacin. C is the third alphabet. ऐसे relax. Very direct, very obvious question, right? And diet low in maize and also sorghum leads to the niacin and the tryptophan deficiency. Tryptophan nahi diya tha in the options. This is what students have told me. If tryptophan has been given, तो हमें थोड़ा सोचना पड़ता, then it would have been a very tricky question. Another question on the same niacin deficiency was the female on the maize as a staple diet, right? History of diarrhea, lesions in the neck region. It is due to the deficiency of diarrhea, dementia. 3 Ds, remember, of the Pellagra, right? Definitely. Or lesions in the neck region is Kezel's necklace. We know that it is due to the deficiency of vitamin B3. Our third alphabet is C. So it is niacin deficiency, right? So dementia, diarrhea se related, whatever option was there, I don't know what was the other options, but this was the correct choice and we know it. We have discussed it also. Maybe this picture was given, maybe this picture was given, maybe this picture was given. I am not sure, but these are from different, various ethnicity. Skin color was different, but इसी तरह दिखाई देगा, right? 3 Ds are diarrhea, dermatitis, dementia. Means we are talking about Pellagra, right? Pellagra. If it would have been a very, very difficult exam, examiner must have been talking about the primary Pellagra or the secondary Pellagra. In primary Pellagra, diet deficient in niacin and tryptophan is consumed, but rest everything system for the digestion of the niacin is okay, right? But in the secondary Pellagra, person is consuming the niacin from the diet, but is unable to use the niacin or consume the niacin. That is a secondary Pellagra. Luckily, all students were lucky and you did not get like very complicated, but very simple 3 Ds of Pellagra: dementia, dermatitis, and the diarrhea that leads to the Kezel's necklace based upon ethnicity. These are the pictures. You could have this in तीनों में से I'm pretty sure you would have seen something in the exam also. Also, it is known as vitamin B3 is also known as anti-black tongue factor. Remember this for future. Okay. Here, this was from the notes also. Pellagra, we had discussed it, caused because of the vitamin B3 deficiency. 3 Ds, diarrhea, dementia, dermatitis, right? And glossitis, stomatitis. बहुत difficult question होता तो it would have been mentioned. Death if not treated. Kezel's collar or necklace region means the scaly pigmented rash around the region. In that region, it is most common in maize and the sorghum eaters. Maize was mentioned in the exam, right? Students were very confident. Sorghum was not, but sometimes sorghum can be there. So maize and sorghum eaters have Pellagra in common, and it should be treated like well in time, right? Because here the leucine, these maize and the sorghums, they have lots of leucine that interferes with the metabolism. Okay, that's how we get all this. And niacin is in all of your body, majorly found in the skin. So mainly the skin issues are like very prominently seen in the Pellagra. So well, I am happy we have discussed it, and I'm pretty sure you have made it right. Now there was this question about a patient with the thione synthase B deficiency that was given in the question. That would have a student have told me which vitamin is deficient or supplementation is deficient. This was the question mark. What examiner was actually asking: deficient vitamin or supplementation necessary to alleviate the problem because of the sister thione synthase B deficiency. So दोनों में choices would have been like completely different. I'll discuss both. ठीक है? So cystathione synthase B deficiency in the notes also here. Methionine and cysteine is involved. Methionine and cysteine deficiency, right, causes this. And there is another vitamin PLP, pyridoxine, vitamin B6 is also involved in this. So one of it, deficiency of one of it will make cause this disease, and supplementation is necessary to alleviate the issues. Okay, here deficiency of pyridoxine, PLP, vitamin B6, right, gives rise to homocysteinuria, again related to cystathione B synthase enzyme. Deficiency leads to homocysteinuria, and that enzyme, cystathione B enzymes, it requires PLP, vitamin B6, pyridoxine, pyridoxal phosphate, किसी तरीके से भी पीछा लिया, pyridoxal phosphate PLP लिखी दिया है, right, that if that enzyme is deficient, pyridoxine is deficient, that will make the cystathione synthase B enzyme handicapped, because it needs that pyridoxine as a coenzyme, leading to the disease. Okay, so supplementation deficiency will cause the disease. Supplementation is necessary. Also methionine and cysteine is involved. So depending upon question क्या frame किया था, which is deficient or which supplementation is necessary, that will derive you to the answer. If these were the choices, which my student was pretty confident, ma'am यही choices था, तो methionine would have been the right choice, और cysteine दिया होता था, not the homocysteine or cysteine. If pyridoxal was given, तो definitely वही choice pick करने का था. Okay, so that was the most accurate choice, else the methionine and the cysteine. Okay, and that was there in our notes also. We are lucky. Okay, we are blessed with that. So now there was one more question with the patient coming with tendon xanthoma, elevated serum cholesterol, elevated LDL, and it was treated with statins. What kind of possible disorder the patient has been suffering it? Very easy, very simple, very straightforward. We know based upon this Fredrickson classification also. I have given you table also. There are 6 phenotypes, right? Type 1, type 2A, type 2B, type 3, type 4, type 5. And depending upon the lipid profile that is given, which one is elevated, we can figure it out. If there is LDL levels are elevated, if there are LDL levels are elevated, which was given in the exam 220 was given in the exam. Okay, if it was elevated, then that choice is familial hypercholesterolemia. Choice B, elevated LDL. LDL is elevated in combination with VLDL, then that is hyperlipidemia. LDL elevated होगा तो hypercholesterolemia. सिर्फ VLDL elevated होगा hypertriglyceridemia. Okay, hypercholesterolemia, cholesterol level is up, LDL level is up, triglycerides level are up, then VLDL. If both are up, both VLDL and LDL are up, then this is lipidemia, is hyperlipidemia, familiar hyperlipidemia. पूरा सब lipids के अंदर आ गया, cholesterol, triglyceride. Okay, so that's how the name is given, right? If the VLDL and the chylomicrons both are elevated, that is hypertriglyceridemia, but not familial, but the combined. Both the chylomicrons and the VLDL are up. अब सिर्फ chylomicrons are up, very simple name, hyperchylomicronemia. Chylomicronemia. Okay, so very obvious question, very simple. LDL levels are up in the hypercholesterolemia. VLDL and LDL both are up, then this is hyperlipidemia. Only VLDL levels are up, then this is hypertriglyceridemia. Chylomicrons are up, hyperchylomicronemia. और एक कॉम्बिनेशन बच गया, that is VLDL and the chylomicrons. Both levels are up, then that is combined hypertriglyceridemia. Okay, in this the serum cholesterol level was up, elevated LDL elevated है तो simple, very simple, straightforward. I'll pick the answer, hypercholesterolemia. Okay, and that was luckily given to us in the in the notes also, indicated by Q. Most commonly asked question Q. Type 2A familial hypercholesterolemia, increased LDL दिया होगा, increased cholesterol दिया होगा, sometimes defective LDL receptors होगा, ApoB100 ligand, like there will be mutation in that also, that will lead to atherosclerosis and the CAD. So luckily we had LDL and cholesterol level up, so the choice was type 2A, that is familial hypercholesterolemia. Okay, so this was there in our notes also. Okay, now there was this question, and students were telling me, ma'am, there was this skin disease that was shown, right? And child with the bite of spots, dry eyes, night blindness, and what is the dermatological finding? Well, definitely this is related to the skin, but I have touched this in class also, just to tell you, nothing too much. You can talk to your skin expert also, but this was given, and the answer to this was the phrynoderma, if this was the choice, because these were the 4 choice students could recall. Okay, so here you see the bite or spots and these kind of the skin problems. वो बोल रहे थे मैम थोड़ा इधर elbow की तरफ something was showing, so probably these were the pictures, but similar looking pictures you must have been seen in the exam, right? So bite or spots, we know there is a foamy whitish cheese like tissues that develop around the eyeball, causing severe dryness in the eye, right? Severe dryness in the eye, and that is because of the vitamin A involvement. So vitamin A has the 3 forms in your body. Okay, it is a group of unsaturated organic compounds: retinol, retinol, retinoic acid. Okay, so you have retinol. OL है तो it is a kind of an alcohol, so it is a vitamin A form in the alcohol form. So retinol, right, also known as vitamin A1 retinol. This is an alcoholic form. Okay, OL. In the 12th we have studied this. Okay, so when the light comes, okay, retinol that converts into 11 cis retinol. Okay, this has al. This is an aldehyde. OL से al बन गया, right? This is your visual pigment. Sunday we had GT 218, and the biochemistry portion I had discussed this entire Wald's cycle, right? How we have the rods and the cones, right? Rods are for the color, cones are for like without the color. In the rods we have this rhodopsin, rod part, and the opsin part. Opsin is a protein part, rod is a like non-protein part, right? So here this is the same thing. I'm discussing it again. 11 cis retinol, it converts into 11 cis retinol, and 11 cis retinol aldehyde can get converted into all trans retinol. All trans retinol. All trans retinol कब हो जाता है? In the when the light falls into it. HNU, when the light falls into it, it 11 cis converts into all trans retinol, and the opsin converts into meta-rhodopsin. Right, so this is how the light sensitivity is going on, and this 11 cis retinol also gets converted into retinoic acid. Okay, what kind of retinoic acid? It is an retinoic acid. When we are talking about 11 trans retinols, then these signals are sent to the neurons, because this opsin part getting converted into meta-rhodopsin. Meta-rhodopsin somehow like a lot of cascade with the CAMP is going on that decrease the calcium influx and the sodium influx also in the cell, and thereby sending the sending the signals to the neurons. Whereas when this 11-cis retinol, the visual pigment, is getting converted into the retinoid, the signals are sent to the epithelia. That is how the vitamin A is related to the skin disease that we have talked here, the phrinoderma. These kind of things will be seen. Okay, vitamin A is just not necessary for the eyes, just not important for the retina only, but it aids in the healthy growth of the skin and the mucous membrane. It promotes the development of the teeth, soft and skeletal tissues. Adult is 750 microgram, but I guess according to the new, it is 900. And it is one of the fat soluble vitamin A. So whenever there is a genetic deficiency in the apogene also, right, that also leads to the deficiency of vitamin A, because this is a fat soluble vitamin. Why do we need it? For the vision, this retinal regulates the gene transcription also, right? It alleviates the immune functions, embryonic development, bone metabolism, hematopoiesis, epithelial health, antioxidants. So, right? For the vitamin A maintains the healthy structures of the mucous membrane. Okay, so phrinoderma, that is how vitamin A and this skin disease is, that is how it is related. I'm not going in detail here. Now, there was this question, most common lipopolysaccharide which is associated with corneal epithelium transparency. Very simple, straightforward question, the keratin sulfates. Okay. Now, there was another question with the boy with a developmental delay, recurrent chest infection and worsening bone pain. Serum PTH was the normal and the phosphate was low. Not responsive to vitamin D supplementation. Which kind of rickets is this? Okay. Now, there were two groups. In one group, student was telling me, ma'am, not responsive to vitamin D supplementation, shayad nahi tha, shayad tha. Let us discuss both. Okay. So, definitely rickets tha, right? And this is how vitamin D is giving, helping with the calcium thing in your body. You have 7-dehydrocholesterol in the skin. In the presence of the ultraviolet light, actually, it gets converted into vitamin D3 cholecalciferol, which is an active form, right? Even nowadays, everybody is taking vitamin D supplementation because of corona. Everybody is staying at home. Everybody is, ma'am, pain ho raha hai, doctor pain ho raha hai. So everybody is getting supplementation of the vitamin D also. Okay, vitamin D cholecalciferol gets converted into calcidiol. Two ols are there via the enzyme vitamin D3 25 hydroxylase enzyme in the liver. Then it is transported to the kidney where 1 alpha hydroxylase enzyme 25 hydroxyl 1 alpha hydroxylase enzyme converts this 25 OH into 125 OH. Means two hydroxyl groups come, one at one position and the second one at the 25th position. Okay, so if there is a nutritional lack, then the dietary should be supplemented. If there is a problem with the enzyme, then you have vitamin D dependent rickets type 1 and vitamin D dependent rickets type 2. I have this link here for you to discuss it in detail with you. This is from the WHO. This is a paper. Okay, this is the paper because I was not sure question में क्या पूछा गया था, so I thought to discuss every aspect with you so that you really know what has been asked and what would have been the answer. And एक scenario change किया है, PTH is normal, not elevated, that will change the answer. If it was given not responsive to vitamin D supplementation, that will change the answer, right? So nutritional rickets have been caused by, I have highlighted the important points. Nutritional rickets have been caused by inadequate intake of the nutrients. Vitamin D dependent ricket type 1 भी होता है, type 2 भी होता है. Okay, type 1 results is because of the abnormalities in the genetic coding of 25 hydroxyl 1 alpha hydroxylase enzyme. Type 2 is from the defective vitamin D receptors. Okay, ये receptors होता है vitamin D को receive नहीं कर पाते, so they cannot process it. Vitamin D is there. We are supplementing the vitamin, but receptors are not responsive, right? So if the choice was given that the patient was not responsive to vitamin D supplementation, so definitely the type 2 is the vitamin D dependent type 2 is the correct choice for us. Okay. Vitamin D dependent type 1 is treated with vitamin D, right? But type 2 is more challenging because it is not responsive to the vitamin D supplementation. Vitamin 2 is a rare autosomal disorder, mutation in vitamin D2 receptor, and does not respond to vitamin D treatments. If vitamin D non-responsive patient was given, then that would have been the scene. In this, normal calcitrol was found in the calcium ka level in the body is usually normal in this kind of a scenario. I will discuss this in the case study in detail. Now, this was another thing I pulled out for you. This is from WHO. This is from WHO guidelines. WHO, World Health Organization guidelines. On back to page number 11, I have highlighted these for you. Hypocalcemia, including seizure, is most common manifestation in vitamin D deficiency during the periods of the rapid growth before age 3 and 10. Hypocalcemia. Elevated PTH is there in the nutritional records. Here, normal PTH was given, right? PTH levels have been reported to less elevated. कम होता है, almost normal होता है with vitamin D deficiency rickets. So non-responsive to vitamin D supplementation and PTH normal was level. That is making us to pick the choice vitamin D dependent type 2 rickets. Right? If it would have been the nutritional rickets, PTH level increase होता, hypophosphatemia, phosphate levels कम होता है. Right? So elevated alkaline phosphate level भी up होता है. ठीक है ना? So तीन चीजें होती. PTH level was up, alkaline phosphate level was up, and the low phosphate level. If this would have been the combination, nutritional rickets was the choice. Unresponsive to vitamin D supplementation, almost normal PTH is indicating towards the vitamin D dependent rickets, but unresponsiveness to a vitamin D supplementation is leading us to only single choice, that is your vitamin D dependent rickets type 2. Serum PTH normal होता है, unresponsive to vitamin D treatment. Okay. Now, there was this question: the person has a meal at 8 p.m. in the night, reports glucose at 7 a.m. next morning. Almost 12 घंटे का was a starvation period, you can say, fasting period, other ways you can say, which came out to be 180 milligram per liter. Right? What is the source of the glucose during this period? Dietary glucose. रात को तो everybody is sleeping, nobody is eating. It was not mentioned. Gluconeogenesis, we are not synthesizing gluconeogenesis because we have still the patient, this person has still the stored glucose. So glycogenolysis would have been the choice, and initially hepatic stores are being exhausted, then the muscle stores are being exhausted. So hepatic glycogenolysis, if only this part was given in the question, the answer was the glycogenolysis. There was one direct question, what type of defect is seen in HNPCC? Very straightforward, very simple question. Also in the notes, also the Lynch syndrome, HNPCC syndrome is related to the mismatch repair. I don't know the order of the choices that was given in the exam, but these were the choices. So mismatch repair was the choice, right? It would have been the base excision repair if there was this polypopsis, homology associated polypopsis was given in the question. If the Bloom syndrome or the Werner syndrome or the breast receptors A or 2, BRCA, breast cancer kind of a receptor was given, that means the homologous repair mechanism was not working properly. Okay, Bloom syndrome is a butterfly kind of a rash or patches are all over the skin when the like small baby or the girl goes outside in the sunlight. Okay, NEHG, non-homologous end joining repair syndrome, works with the SCID, your severe combined immunodeficiency syndrome, and the radiation sensitive SCID. So question made directly the HNPCC or Lynch syndrome was mentioned. Mismatch repair was the correct choice. Now this is student was telling me, ma'am, there was this cycle kind of a thing given with the pyruvate, with the acetyl coenzyme A and the lipoate, and there were arrows. ऐसा कुछ था definitely. I know you are listening. There were arrows in which they have not labeled the enzyme, and they were asking to label those enzymes. Okay, so this was a question for the pyruvate dehydrogenase system, PDH, pyruvate dehydrogenase system, and we have discussed this many times in the class, in the GT also. PDH is a big complex system. It is not alone, but it is a big complex system. 3 enzymes, they work together. Okay, so you can imagine I have 3 hands, 1 hand, 2 hand, 3 hand. This is not the face but a hand. With 1 hand, I am doing a reaction, hand it over to the second one. The second hand does kind of a reaction and it hand over to the third. And then the third does it and final product comes out. So all they work together. One shifts it to the 2, second enzyme complex shifts it to the third enzyme complex, giving you the final product of the pyruvate dehydrogenase system. पूरा enclosed chamber है जिसमें E1, E2, E3 तीनों चीजें हैं. ठीक है ना. When it comes out of the pyruvate dehydrogenase complex का chamber में से बाहर आते हैं, so you get the product, and that product here is the acetyl coenzyme. So pyruvate getting converted into the acetyl coenzyme A is a big complex mechanism done by pyruvate dehydrogenase system, which has the 3 complexes, E1, E2 and E3. E1 is pyruvate dehydrogenase activity. E2 is dihydrolipoamide acetyl transferase. Acetyl group has been transferred. Acetyl transferase, okay. Dihydrolipoamide dehydrogenase. Dehydrogenation is going on. Name is telling you what is going on. First is pyruvate को dehydrogenase किया. Second में acetyl group का transfer किया. Third में जो भी बना है उसका dehydrogenation किया. तो pyruvate first via enzyme complex E1 gets converted into thiamine diphosphate, or you can say hydroxyethyl thiamine diphosphate, which gets converted into acetyl lipoate via enzyme E2. Acetyl lipoate via enzyme E2 and also E3 is involved there, gives you like NADH that goes in the electron transport chain, and you have the acetyl coenzyme A again by the reduced lipoate getting back to the oxidized state again. This is how enzyme 1, E2, E3 are involved. I'm pretty sure in the exam they were asking you about the E1 and the E2, because E3 is a complex mechanism we don't discuss in MD classes or doctors, but this is more of a hardcore biochemistry question. So E1, E2 was probably being asked. Name E1 is a pyruvate dehydrogenase. E2 is the lipoamide acetyl transferase. Okay, and that was the last question. Just a last message. Remember, life is always this exam. Exams will always be there. वो आते रहेंगे. If you come out with the flying colors in this exam, you have more exams and more difficult roads ahead. If unfortunately you don't do it, you know, probably you have not studied very well. Sometimes bad luck also happens, but that is not an end of a life. That is not the end. Keep trying. And I'm pretty sure there is definitely the best thing in the whole wide world waiting for you. So just give your 100% to every exam. That is my humble request to everybody. Just calm down, enjoy your life, study, give your 100%, and you will get the results. That is my 100% guarantee to you. If you are sticking with the DBMCI eGurukul notes, stick with it, because we as all the teachers have a group. If I have left out something, I know Dr. Neha is there to take up that and do it. I know Dr. Ashish is there and he will cover. So we all together have a group, and एक टॉपिक कोई छोड़ता है तो दूसरा बता रहा है, तीसरा बता रहा है. तो entirely holistically, if you read every note, everything, you get all the knowledge that is needed and most necessary for the exams. Sometimes students, they complain not in detail, but every time details are not necessary. Target is necessary. Target is the keywords, the last minute revision points that is given in the biochemistry book also. That is, we do it in GT also, that we highlight in the class, during the class also. So just enjoy your day, have fun, and दूसरे काम पे भी लग जाओ. Good luck. Bye bye. If you have any questions, any concerns, or any queries regarding what I have explained you in this, you anytime can email me. My email was given in the first slide. Again, if I am always open for the challenges, I know what I am talking about, right? Because I do a lot of research before I give answers to you. Okay. Bye. Good luck.